So we're going to talk about neuroinflammation. So with neuroinflammation, we can say there's a lot of causes to it. So biotoxins can cause neuroinflammation. So when you think of that, you think of Lyme disease, viruses, bacteria, anything that cross the blood-brain barrier as far as a biotoxin can cause neuroinflammation. Lipopolysaccharides have been even known to cross the blood-brain barrier. So even if you have a biotoxin like a gram-negative bacteria that's being broken down by your immune system, liberating lipopolysaccharides, that can cross the blood-brain barrier, and that's going to cause neuroinflammation. Most of the research on neuroinflammation is coming off of all the post-concussive research that is out there. So concussions, trauma to the head, repetitive micro-trauma to the head is causing neuroinflammation. So when we think of neuroinflammation, at least when I used to think of it, I thought, oh, it's just like inflammatory cytokines in the brain that's causing this, or other inflammatory markers, chemokines, and a ticked immune response in the brain that's causing this that our body just has to clear out. Well, we're going to learn that it gets a little worse than that when we really understand that. Even vascular injury, normal aging causes neuroinflammation. So if you have family members that are ticking up in age, this is a good thing to learn about on how to deal with neuroinflammation. And they're finding even emotional traumas can cause neuroinflammation. And we get to dig into this and understand that it's the microglial cells that we're talking about. We're going to find that even PTSD issues. So someone who already has some neuroinflammation that is latent, and they have PTSD issues, so they're reminded of some trauma, can cause an increase in neuroinflammation. And when we're done with this talk, you'll understand why. So some gross anatomy, we all know, everybody in this group understands the gross anatomy of the brain, the frontal lobes, your executive of the brain, your parietal lobes, mainly your sensory input to the brain, your little bit posterior frontal lobes are your motor cortex, your occipital controls, your optical function, and then the cerebellum controls your movement issues with the brain. Then you got the midbrain that controls all your autonomic function. So the other thing, when we get into a little microanatomy of the brain, we talk about neurons. So everybody thinks about neurons when they think about neuroinflammation. It's affecting neuronal activity. Well, it is often affecting the neurons. So remember, the neurons are what carry the messages. So it carries the messages along that axon to communicate with the next neuron, and that's how function takes place. But when we're talking about really what is the cause of brain inflammation, we're really talking about the glial cells. So if this is new information to you, or if you haven't really studied brain function since back in chiropractic or medical or naturopathy school, remember that you have several different types of glial cells. And glial is really Latin for glue, because that's really what they thought these cells did. They just kind of held together the neurons. That's all they really do, don't they? Well, recent research has found that actually the glial cells conduct activity, conduct communication. And glial cells do a lot more different things. There's different types of glial cells. There are oligodendrocytes, there's astrocytes, and there's microglial cells, the main ones that we're going to be talking about. So the oligodendrocytes in the brain are what form the myelin sheath. So the myelin sheath around the nerve axons help that axon conduct electricity really quick. So some of the demyelinating diseases out there, like MS and such, affect those myelin sheaths, and they can be because of what we're talking about today. Neuroinflammation can be because there's a biotoxin in the brain, and it's causing direct destruction of the oligodendrocytes, the myelin sheath cells, and causing demyelination of a nerve, which causes all sorts of problems that you've heard about. And then there's the astrocytes. The astrocytes are very important in the brain. They do a lot of different things in the brain. The biggest thing we're going to talk about with astrocytes is one of the main functions they do in the brain is they create the blood-brain barrier. So what your blood-brain barrier that you hear about, oh, we have this blood-brain barrier. What's the blood-brain barrier? It's literally astrocytes wrapping around your blood vessels in the brain. So your blood vessels that go through the brain, remember all that whole blood vessel loop that goes through your brain, it's wrapped. So the blood vessels themselves are endothelial cells. So those are epithelial cells that are specific to the blood vessel itself. We call them endothelial cells. Single layer of endothelial cells wrapped in smooth muscle and then wrapped in astrocytes. That is your blood-brain barrier. And there's different things that can damage a person's blood-brain barrier. Toxins, number one thing you can damage blood-brain barrier. And remember, before a person is 3 years old, they don't even have a blood-brain barrier. Those astrocytes aren't even functioning. So you take a little newborn baby and you inject it with toxins called vaccines, guess where they're going to go? They're going to circulate around the bloodstream and they're going to be deposited wherever they want to go. And they can cross that non-existent blood-brain barrier, get inside the brain, and cause all sorts of havoc. So all those different chemicals that are in vaccines that are necessary in order to spark an immune reaction to hopefully create antibodies, the purpose of vaccines, crosses the blood-brain barrier, causes all sorts of inflammation and damage to these other cells called microglial cells that we're going to find out. So astrocytes form the blood-brain barrier. Astrocytes also function in helping clear the communication, the space where neurons communicate. So they help clear those neuronal messaging signal molecules. So astrocytes are super important, but we're really going to talk about microglial cells. So microglial cells do the function in the brain that you could think that macrophages do in the body. So remember your immune response. So when you have an immune response, you have circulating macrophages that are already activated macrophages, meaning that they're circulating around looking for pathogens to wrap themselves around, engulf, and destroy. That's called phagocytosis. So they phagocytize different amoebas and parasites and pathogens and bacteria and viruses. They wrap around those things and digest them. That's what macrophages do. That's what microglial cells are to the brain. So think of, well, does the brain have an immune response? Does the brain have an immune system? Remember, the brain is encased, right, by our skull. It's encased by our dura mater and our layers that we have that protect it. And then it is separate from the rest of the body thanks to the astrocytes, the blood-brain barrier, right? But, so, well, how does the brain fight infections then? The brain fights infections through the microglial cells. So microglial cells actually travel through the brain like macrophages do through the bloodstream, and they travel through the brain and they engulf things and they destroy things, and they can help carry toxins out of the body and bring it back to the vessels. And that's what they do. While we sleep, matter of fact, our brain actually contracts when we sleep, and it allows the microglial to become even more active. So microglial cells are the immune system of the brain. That's what microglial cells do. So when you read in the literature about this, because hopefully this will spark you to look up some different data about this, there's a lot of different terminology. Terminology is called resting microglia. Actually, that's actually old terminology, because now we know they're really not resting at all. They're traveling through the brain, digesting things, breaking things up, killing pathogens, and getting rid of inflammation in the brain. So they're really not resting. So it is actually old terminology. But this is obviously just a sketch by somebody, but they did that sketch because that's actually what these microglia look like. They have all these little connectors, and if I knew how to create PowerPoints a little bit better, I would have put it on a video on it, because I have a video of these microglial cells traveling through the brain, and they're like grabbing things and engulfing things, and they're moving around like starfish with a lot of different legs, moving through the brain tissue, cleaning up the brain. That's what microglial cells do. Now they can become activated. That's the terminology used, is activation of these, and that actually means, it's not really a good term though. So again, this is old terminology, but activation of resting glial actually means they're damaged. So microglial cells can become damaged, and then they can move to one of these two states. And here's an example of if they're activated with IL-4, so this is done in an experimental situation in a laboratory. If you stimulate them with IL-4, which is a Th2 cytokine, you will activate them into what's called the M2 state. And we're going to hit this really hard. If you activate them with lipopolysaccharides, you'll activate them into the M1 state. Both of these states are not great. The M1 state is really bad. That's what you got to remember. M1 activated microglial cells, or M1 damaged microglial cells, or what the new terminology is M1 primed microglial cells. So the new terminology is primed. So resting microglial, or healthy, moving around, devouring microglial can get damaged or primed. Then they can get primed in the M1 state and the M2 state. And they can go back and forth between M1 and M2. Problem is that if they stay in the M1 state, and we're going to talk about why they would, they're spewing out all these inflammatory cytokines. INOS, that is inflammatory nitric oxide synthase. That's IL-6, that's a very highly inflammatory cytokine. TNF alpha and IL-1B, these are inflammatory cytokines. So in the M1 state, they just sit there and spew out. Now, one other thing that this picture doesn't really show well, and I'll show you later, that in this active, healthy state of a microglial, remember they have all these little things that are going around and they're traveling around the brain, cleaning things up. When they get primed, they lose that. So they're just kind of sitting there, doing not much of anything. In the M1 state, they're spewing out inflammation. So M1 state, M1 primed microglial are a source of chronic inflammation in the brain. What causes this? Go back to that other slide, back here. So what causes this? This. Trauma to the brain causes priming of microglial cells. Vascular injury causes priming of microglial cells. Toxins in the brain, biotoxins in the brain, autoimmune issues. So you have antibodies to self-tissue, neurons, and antibodies to microglial cells causes priming of microglial cells. Aging, you will, as you age, you're getting more of your microglial cells primed. Emotional traumas. So all those things cause this priming of the microglial cells, and then they're either going to be in that M1 state or in the M2 state. And we're going to talk about some things that can push M1 state microglial cells to M2 state microglial cells. Once those microglial cells, that normal, healthier, traveling through the brain, gobbling up pathogens, once they become primed and they lose those fingers and they just kind of sit there and either spew out inflammatory cytokines or in the M2 state are spewing out anti-inflammatory cytokines. Oh, we really want them down here, don't we? Yes, we do. They never become unprimed again. So this is where someone with serious concussions, and they have serious head traumas and serious emotional changes in their life, you're never going to unconcuss them. So this is where someone with serious dementia that has serious inflammatory symptoms, serious mood changes, serious issues, you're never going to unprime those microglial cells. This is a fried egg. It's done. Now what you can do for these people though is push M1 prime microglial to the M2 state. They're never going to be really healthy and active, helping cleaning up the brain. Remember though, you have hundreds of thousands of millions of these cells, right? It's a percentage game. So, well, as we age, are we just all toast? Well, not necessarily. So if you proactively make some decisions to keep this from happening, priming from happening. Well, you can't always proactively decide whether you're going to get a car accident or not, right? But you can proactively help push M1 prime cells to M2 prime cells.
So M1 is considered dysfunctional?
So both of them are dysfunctional. So both of them could be considered pathological. It is both. It is. Understand that it is part of normal aging, and the percent that a person has more prime glial cells is the percent of dysfunction there.
So you really don't want a glial cell, microglial cell prime.
You don't want any prime. You're going to have some prime. It's not a matter of we're going to prevent all priming, but knowing that this happens can help make a decision whether maybe I don't want my kid playing football, right?
Is there a mechanism for cleaning up, and regenerating new ones and get rid of the old ones?
No, there's no known regeneration of microglial cells. They don't regenerate and they don't unprime. Now you have a lot of them, so it's not a lost case. Now it is a lost case if somebody is in, grade 3 dementia. Okay, you're not going to take them
Let's
back.
figure out how to unprime them now.
You can't take them back. You can, but in those cases, or somebody who has serious post-concussive syndrome, you could go, okay, well, you have to prep your patient. We're not going to take you back to when you were 20 years old. The best we can do, we can halt this. We can slow the progression tremendously. So, you're going to, have, 4 more years before you're in serious Alzheimer's, dementia, and we have to put you in a home. Could we make it 10 more years? Yeah, that's realism.
So toxins, trauma, pathogens in the brain are what are driving these to the prime state?
Yes. Yep. So, is it a good measure for a functional doctor to, well, I'm going to work on getting rid of these toxins, we can't get rid of the trauma, but we can get rid of, we can do some things to prevent this, right? But we can definitely push M1 cells to be functioning as M2 prime cells, and that makes all the world of a difference.
What's the biggest advantage of doing that?
So this is, M1 prime cells are spewing out inflammatory cytokines. They are a source of inflammation. They're just sitting there as a chemical factory of inflammation. M2 cells are spewing out anti-inflammatory cytokines. So that M2 cells, even though that's pathological, because they're primed, they're doing a good function.
Interesting.
With that diagram, are you saying that LPS could actually be leaky gut is almost in some cases worse than concussion?
Well, definitely. I wouldn't say, it's hard to say it's worse than something or not, but it's just as much of a source. In all the research articles, they're using LPS to demonstrate this, which tells you, boy, we get LPS in our body produced through all sorts of different things. And for me, treating Lyme patients, that's just a light bulb moment, because lipopolysaccharides are in the cell membranes of gram-negative bacteria, and that's what's going to be generated when you kill Borrelia. So it's a huge negative, right? So you got to be careful how fast you kill these things. You can't overwhelm the liver's ability to get rid of lipopolysaccharides. Does that make sense?
They'll be more toxic.
Yes, you can make them sicker. So if you're going to treat a Lyme patient and you're going to hit them with a whole bunch of biocidin and kill things. So we use a rifle lot. You can't run a lot of kill programs on these people. You can't kill Lyme disease too quickly. And I mean, literally, do not try to kill Lyme disease too quickly, you could make the person a lot sicker, especially if they have a damaged blood-brain barrier, especially if you haven't looked at their liver detox pathways closely. Okay?
But could you use, I mean, you brought up biocidin, so you obviously know the products of the company too, but so if you were doing a kill protocol, whether not biocidin or dysbiocide or something else, could you also do like a GI detox where you have the zeolite or a binder, you know?
So we talk a lot about 7 phases of detox. So I made that up at one lecture I was talking about. I thought, oh, that's pretty good. I should write that down. So we talk about phase 6 is you're excreting it into the toilet, right? Phase 5, you're binding it in the gut,
Okay.
right? Phase 4, you're getting it out of the gallbladder. So you have to make sure that the bile is less viscous, right? So it can move out of the gallbladder and it's not getting clogged up. Phase 3 is in the liver, phase 2 is in the liver, and phase 1 is in the liver, and you could say phase 2.5 is in the liver too. So those phases are all in the liver, conjugation and breakdown and binding and turning it into water solubleness. So those are your cytochrome P450 pathways, your PON1 pathways and such. And you have to be making enough, you have to be utilizing like phosphatidylserine and phosphatidylcholine in order to be creating bile. So you have to be able to create enough bile because bile is the transport that gets those toxins out of the liver. Then phase 0 is the phase where people, what we term phase 0 is the phase where you have to be careful with that you're using chelators. So when you're pulling it out of the body, so remember, okay, if I'm exposed to a toxin, because I went out and breathed in some gasoline fumes right now, went through my alveolar spaces, right into my bloodstream, it's circulating around in my bloodstream and it's going through the liver. If my phase 1, phase 2, phase 3 are backed up, it's literally going, hey, can we come through here? And the liver's like, hey, forget it, take your turn. Well, it circulates around my body again, and then it goes back to the liver. Hey, can we come through? Okay, we can take a few of you now. And the rest of you go around. It circulates around again. Chance of it getting deposited in a cell is high. The more times it goes around the body, right? So it gets deposited somewhere in a cell or in extracellular spaces. That's what ends up wreaking havoc for a person down the road, right? So that person has heavy metal toxicity. What does that mean? Well, they have heavy metals in the tissues. It's not circulating in their blood right now, right? So they have heavy metals somewhere in the tissue. So, we should use chelation therapy. So we're going to pull it out of the tissues. Wait a second. You better make sure you check on phase 6 first. Phase 5, phase 4, 3, 2, 1, before you start doing phase 0, which is chelation. Same thing when you're killing Lyme and producing endotoxins like lipopolysaccharides. So endotoxin is anything that you're generating from killing something else, right? So you're producing lipopolysaccharide endotoxins. You better make sure that phase 1 through 6 are okay, and really healthy before you're going to, either produce a bunch of endotoxins or think you're going to chelate some out of the tissues to get through the liver, right? So, too much information there, but I think most of you guys understand that fully, right? Because these things can then cross the blood-brain barrier, and it's certainly not just lipopolysaccharides. You're circulating mercury or something else crossing the blood-brain barrier, especially if that person has a damaged blood-brain barrier. It's crossing the blood-brain barrier, and what it's doing is it could prime microglial cells, but any primed microglial cells you have, it's going to push them towards M1. So all the things that I said can prime a microglial cell can also push primed microglial cells to M1, where they're just spewing out inflammatory chemicals. Follow me? Mm-hmm. So healthy microglial travel through the brain, kill things, get rid of stuff. If they're not healthy microglial, they can be primed. That's a pathological condition, is not reversible. They're either going to be in the M1 or the M2 state. M1 state is going to spewing out inflammation and increasing the inflammation. M2 is going to be decreasing inflammation. So then the key is, wow, I don't want to make this worse. So to your point is, well, making it worse would be killing too quickly, creating more endotoxins, making sure, the first thing I should be doing is making sure that gut is healthy, making sure I am detoxing well, maybe looking at genetics, maybe looking at different detox pathways, and then feeling where you're going to kill very slowly so you're not going to hurt that person, and you're going to be able to get rid of what you're killing, right?
What creates an unhealthy microglial cell? Where it drives into that, where it primes it? Is that the toxins typically?
Yep, so
That
that
bunch of species
what
are-
causes this to go to any prime state is that first list we went through.
Okay.
Biotoxins, toxins, chemicals, traumas, head traumas, concussions. There are some genetic factors in there too. The genetic factors, the APOE genes. But, so, let's
How
say
do
I
they study
have
the
them.
emotional aspect of that? Like, how do they determine it was an emotional event that created the prime?
How could you determine that?
Yeah.
Well, just from a clinical standpoint, people with serious emotional issues that can cause a priming. And I do believe that you really look at, okay, well, what's the mechanism? It's serious emotional events cause different chemical reactions in the body that if this person has damaged blood-brain barrier that cross the blood-brain barrier, that's what's doing
That's
it
gonna do it.
from a cause and effect standpoint.
Wouldn't electronic interference be causing a lot, an
Well,
increase in?
Here's the thing, EMF exposure. So some people will be like super sensitive to EMFs, and some people are like, what are you talking about? I don't sense anything. People with M1 primed glial cells are way more sensitive to EMFs. These are the greater amount of these you have, that is your environmentally toxic person. I can't even go in a room where I smelled that person had perfume walking down the hall. Some of these people that you've like, I think that person's freaking crazy, They're not crazy. They have so many M1 prime glial cells, anything sparks them. Plus, most likely they have a very fragile, damaged blood-brain barrier. Fastest way to get something in your body, right, is to inject it. Second fastest way is breathe it in. Or probably faster than all those things is to have those waves go right through you, right? So EMFs, breathing in toxins like perfumes and stuff, might all have patients that are super sensitive to those things, and then you might go, oh, for Pete's sake, that is a sign right there. Oh my gosh, I can't even breathe in, I can't even go in there, I'm so sensitive to this. All you gotta do is, see, how do you know if someone has M1 prime glial cells? You either get them to volunteer for a full brain dissection, or you go off their symptom pattern. So,
would you put that in some of the genetic category where I call them the sensitive ones that come in, where you can almost by looking at them tell that they're just, you've got people that come in that are bullets and people that come in that
well, there are some genetics.
5 years ago I painted in here.
There are some genes that make people a little more sensitive to EMFs per se, but this isn't. This is more than this is not a genetic cause here.
Okay.
So yes, there are some genetic pieces to it. What I talked about with Alzheimer's disease, but there also has to be an environmental cause to it.
So when you're seeing, like, say, a kid in school, they bring in 5G or whatever. When they brought in iPads at my daughter's school, what I saw is the kids with ADHD, ADD, just it's exponentially worse. That would, even though it's not a diagnosis, what you would be thinking is they have this going on.
So when
But
you
would
really,
already
when you
think
really
that 'cause they have
understand this,
ADD.
when you really understand this, spectrum disorders
Mhm.
are primed glial cells.
Yeah, I know that.
So, do vaccines cause autism? The vaccines are another source of toxin that crosses the blood-brain barrier, or before 3 years old, the absence thereof, and primes glial cells. Now, it gets worse. So let's say that child, well, why doesn't every child who gets a vaccine have prime glial cells. Well, the truth is, probably every child that got a vaccine does have prime glial cells. It's to the degree. Well, what makes that difference? Well, part of what makes a difference is how healthy are their genetic detox pathways. Did they have a mother that had a lot of PON1 and MTHFR and cytochrome P450 defects that they inherited? So because their phase 1 and phase 2 is going to be slower, so the liver's going, no, go around again, no, go around again. How come we didn't see that aluminum toxicity come back? Oh, it got deposited in the brain, right?
Which is where it wants to go. 'Cause
Yes,
the fat.
and what did it do? It primed glial cells. Interesting note also is in these studies, they're saying that post-concussive, the person's symptoms can be latent, meaning 10 to 20 years later, now they're having all these crazy weird symptoms. It's from the concussion 20 years ago. It's from their car accident that they don't even remember having. They didn't even put on their new patient for. So look for that. Ask them. Wait a second. Did you ever get hit in the head? Did you ever fall off a stool? Did you ever? Well, once, but I never had a problem with it.
Did you ever go to college?
So you have to ask those questions because they won't remember the damage if it's physical damage. I never had any issues. Of course, yeah, I used to play hockey. I get slammed all the time, but I never had any issues. Sure you didn't. You had prime glial cells. Now as you're aging, and your diet has changed, your lifestyle has changed, and that's what we're going to talk about. So they might have been in the half of the M1, half of the M2 state. You didn't really notice a lot. Now they're just 90% in the M1 state. Now you're getting symptoms.
And now in this concept, an emotional trauma wouldn't be any different than just a physical
Yeah.
concussion.
Okay. Get this? Understand this? Here's another picture out of this article in Frontiers in Aging Neuroscience. They use better terminology, I think. Patrolling microglial. I like that. Patrolling around, destroying things, looking for bad guys, killing bad guys, right? They get primed. They move from this state with these nice little fingers where they're walking around fighting these bad guys to primed, either in the M1 or M2 state. M1 state, spewing out inflammation. Our M1 state, spewing out inflammation. M2 state, decreasing inflammation. Yes.
Did you say you could make an M1 become an M2?
Yep. These go back and forth. We should have arrows that go both ways here. These can go back and forth by choices that you make. So emotional trauma, again, is going to push it back this way. Head trauma, again, is going to push it back this way. More assault of biotoxins or more assault of toxins is going to push them that way. So your job as a practitioner is to help detox this person, get rid of their toxins, and do some things that will push it this way.
So is that why you see, like in a Lyme person, where they seem so much better, and then all of a sudden they're taking a dive again, and then they're doing so much better, and then they're taking a
So
dive?
yes, and yes, where that's where they'll move to this state and they'll have a decrease. And they'll just, oh my gosh, I had my first normal day. The next day, what did you do to me? I couldn't even get out of bed. Okay. Well, what did you do? You overdid it because you had such a great day, so you went for a walk, right? So you just got to talk them through that. As we're teaching them, this will really help, so they'll understand. Oh crap, doc! I just pushed my prime glial cells back to M1. So, we believe in our clinic is education is really important. The more we can educate them, the less they depend on us, right? That's why we have like 400 YouTube videos. So the more you can teach your patients to think like you, then they won't be bugging you so much.
Can you turn that back real quick? I just want to take a quick picture. Sorry. You can even watch news, right? And thank you.
Yeah, exactly. It's too traumatic.
Especially recent news.
Yes, absolutely, totally agree. So how do you push prime glial cells to M2? Okay, so first of all, you have to do it very carefully, all right? So if you think as a practitioner, like, okay, I'm gonna be a Lyme practitioner, and what we're gonna do is we're gonna go and use all this kill programs, and we're gonna use all these herbs and all this stuff, you could tip this person over super, super quick for a lot of reasons. And we could talk a lot more about Lyme, especially with autoimmune issues. So if the person is autoimmune, so this gets even exponentially worse if they have antibodies to neural tissue. You want to know why? So if they have antibodies to neural tissue, how do you know if somebody has antibodies to neural tissue? You can run a lab. Cyrex lab has a great lab for neural antibodies. If you have a patient in this state, you run the Cyrex lab and they have antibodies to neural tissue, they're messed up. This person is sick. This person can be labeled with different personality disorders.
Is that already 9?
I don't remember. I think it's 7. So these people can be labeled with personality disorders. They can be labeled with bipolar disorder, all sorts of different things. Because if you have antibodies to neural tissue and you are spewing out inflammatory cytokines, that's going to stimulate your healthy microglial cells to kill that which you have antibodies against. You guys understand? Immunology 101. If you have antibodies to any tissue, you have thyroid antibodies, and you're going to strongly stimulate the immune system, you are going to help your body kill the thyroid gland. So if you have antibodies to any cell tissue, you don't want to be overstimulating the immune system with immune stimulants. Okay? So if you run Cyrex 7 on these people and they have neuronal antibodies, you don't want to be giving them kill herbs. You will help their healthy microglial cells kill brain tissue. Crap, how do I kill the Lyme then? You don't worry about killing the Lyme right now. You have to push your goal in life as a practitioner is to push M1 prime glial cells to M2. Make that your patient's goal in life. Quite honestly, our secret, you want our secret for treating chronic Lyme? Don't try to kill the Lyme. You have to treat the immune system first. You have to get rid of the inflammation. You have to heal the barriers. So phase 1 in pushing prime microglial cells from M1 to M2 is start with lifestyle. Start with exercise. Very, very moderate exercise. They might be able to walk a block. That might be too much for them. Over-exercise is one of the worst things for this person. You over-exercise, what are you producing? Tons of lactic acid. Lactic acid can cross the blood-brain barrier, cause greater inflammation, and push M2 microglial prime cells to M1. Do not over-exercise. Go really slow, but they need some exercise, because light exercise will help decrease inflammation. You just go one more step further, and you flip them. So everybody's different. So you have to make sure you teach that to them so they don't hate you when you tell them, go do some exercise. No alcohol. Alcohol, in all the studies, have shown to absolutely flip M2 to M1.
Does that mean so even herbal tinctures with alcohol? Or
There's not enough in that that's going to make a difference. Any pollutions. There's the person that, oh my gosh, I breathed in for a few minutes, just took me over. They have to be getting sleep, because in sleep your brain actually shrinks. That's where your microglial become active. EMF protection. Get them in a safe place for EMF and help them reduce stress. Start there. Then you could go into diet, no gluten and dairy. You guys probably all know that, how those are hyper-inflammatory to the brain. Consider having go paleo. Consider looking at histamine. If you do genetics, look at all the histamine genes. Run Cyrex 10 for food sensitivities. If they got antibodies to different foods and they're eating those foods, what happens when you eat foods that you have antibodies to? You're going to create inflammation. So anytime you're creating inflammation, you're pushing M2 to M1 again. Consider doing keto. Understand, anytime you create inflammation, you're pushing M2 to M1. That means if this person gets a cold, they can crash. And TRE is time-restricted eating. Fasting can be really good for these people. Okay? So, but we typically tell people not to fast more than 24 hours.
Why not?
Fast more than 24 hours, you'll increase IGF-1 levels. And that could cause more problems. Nutraceuticals. Now you get into some nutraceuticals. And many times, remember, this is like the third step, okay? You might not start with this right away. So AI is a product that we've formulated, that we use, and I had this slide for another talk I did. But there are nutraceuticals that are anti-inflammatory. So AI stands for autoimmune. It's a product that we formulated for autoimmune patients. These people should be treated as if they have autoimmune disease, even if they don't have antibodies to brain neuronal tissue. You should be stimulating the Th2 side of the immune system. So you're using things like curcumin. You're using things like green tea extract. So let's talk about US enzyme products. What's got curcumin in it? Sun Spectrum. So Sun Spectrum is a great product for these people because it's going to help heal the barrier of the gut. It's got CoQ10 in it. It's got curcumin in it. T-Vigo, great product for people in this category. So T-Vigo is EGCG. That's going to be something that is going to drastically reduce IL-6. Remember, IL-6 is something that spews out from the M1 prime microglial cells. So we're pushing it to the M2 state. Butyrine, which is another product that you could use to help heal the gut. Different minerals can be beneficial. Omegas, glutathione is very beneficial. Brain-derived neurotrophin factor support. All these things do support brain-derived neurotrophic factor. Cytokine support, anything that you're going to decrease Th1 cytokines with. We use a product called NeuAdapt, which has got Bacopa in it and some other brain adaptogens in it. Gut support, binders, remember to support all 7 phases of detoxification. And then there's some other things that can help with the blood-brain barrier as well. Does that help? Remember how many more slides we have? Oh, here we go. Blood-brain barrier support, and then you start getting into dealing with these infections and toxins. But that's got to be later. If you jump into this right away, I could have put blood-brain barrier support in phase 1. And if I change these slides, I would. But if you start trying to kill toxins right away or deal with chelating right away and different things like that, then that's going to be a huge issue. If you create a hypoxic situation, that is actually pushing to an M1 state. Masks, anybody?
Yeah.
Masks push people from an M2 state to an M1 state. That's why people that wear masks get dumber. But this is where overexercise comes in too. You're overexercising, you're doing aerobic exercise. Oh, that's really good for your muscles. That's not good for your brain if you have prime microglial cells. balancing hormones, looking for other autoimmune issues, oxidative stress. So what can you use from a product standpoint with US enzymes to deal with oxidative stress? A relatively new product that they just came out with, Youth Zyme, right? So those are some things that you want to think of with this. Goal in life is to push M1 microglial cells to M2 state. This should be all of our goal in life. I take these products all the time, curcumin and resveratrol and all these polyphenols and flavonoids that are so good to help decrease inflammation. Questions?
Blood-brain support?
What?
To support the blood-brain barrier? Like,
Ginkgo is really good to support the blood-brain barrier. Vinpocetine is very good. Vinpocetine is very good to support the blood-brain barrier. Those are two really good things for blood-brain barrier support. Helps build astrocyte support.
Resveratrol?
Resveratrol.
A quick question back when you were talking about omegas, are there specific omegas that work better than others for this particular?
Depends on how healthy the person is, whether they could take parent oils or not, but just use, I mean, DHA is your best one for the brain, but still getting a balance is good. Was this helpful?
Awesome.
I think that was my last slide.
Right on time.
Right on time.
Yeah.
Any questions at all on that?
Could anybody ever have too many M2?
No. You could say that, no, you can't.
Is there helpful particularly anti-inflammatory things?
So one argument is like, okay, what if you have brain cancer? I want an immune response in my brain to kill this brain cancer. Well, the immune response that you want in your brain to kill the brain cancer are those healthy, patrolling microglial cells. Okay? So it's the patrolling microglial cells. What hinders the patrolling microglial cells? Inflammation. So inflammation spewed out, toxins and such too, but inflammation that's spewed out by primed M1 state microglial cells. So when you're trying to kill cancer that's not in the brain, same thing. What's your hindrance in killing cancer that's not in the brain? Is this inflammatory cascade that's taking place around the cancer that you're trying to clear out. That's why curcumin is good for any cancer, because it's helping decrease that inflammatory cascade or that wall around the cancer, so that your macrophages and T cells and lymphocytes can get out there to kill it. So same thing with the brain. So brain cancer, if your immune system is going to kill the brain cancer, it's going to be the patrolling microglial cells. And what hinders them is inflammation, and inflammation that's produced by M1 primed microglial cells.
I have a machine called frequency specific microcurrent. I'm not sure if you've heard of it, but the biggest thing they can claim about it, because they've proven, is how it takes inflammation out of tissue, and you can put frequencies in for the brain for inflammation in specific areas of the brain. Now, I don't personally have one for these cells or whatever, and I'm just wondering if you were to consistently do that with someone. I know it doesn't necessarily fix the problem in their body, but is that something that for something like this could be really well just
we use the Rife the same way.
Yep.
So and really for any Lyme patient that obviously has got brain issues because of it, so they have Lyme brain, you could say. We don't start with kill programs. We start with complete anti-inflammatory protocol.
Okay, because that's what I've noticed, like with my daughter has Lyme, and Dr. Lindsley's helped her a lot, but one of the things we noticed too is when when she would start to feel real sick, I'm like, I don't think this is the Lyme, I think this is your detoxing, it's not like you're not getting out. I would run the lymph protocol
Yep.
on the microcurrent, and then by the next day she was really greatly improved.
Yep, so you're decreasing inflammation, and that's what you wanna be focused on.
Okay.